Good afternoon. My name is Lee Poythress, and I'm one of the internal medicine faculty at Baylor College of Medicine. And today, what we're going to talk about is professionalism and how it pertains to you as residents. If you think about professionalism, what I'd like you to do when I talk to you for these first few moments is sit back and define professionalism for yourselves, particularly how it pertains to being a resident. While you do that, I want you to know that in the past several years, the topic of professionalism has become extremely important to the bodies that govern us, through medical school all the way up until postgraduate years. There's the American Association of Medical Colleges, the American Council of Graduate Medical Education, and the American Board of Medical Specialties. And all of these groups have worked to define, to evaluate us, to grade us, and ultimately to enact what their vision of professionalism is. Now, professionalism in these various definitions, and there's many of them, generally focus on some particular attributes which they find associated with professionalism. Things such as behaviors, commitments, obligations, principles, values, and virtues, and other things that you might find associated with being a professional. More recently, there was a study that looked at professionalism and tried to interpret it as a belief system or a foundational purpose for being a physician. All of these things have in common the fact that they are different, that they're not common to each other. There was a study, a review article in 2011 that identified 126 papers, and of those, they utilized 26 that they felt worthy to look at and to see if they could discern a unified definition of professionalism in medicine. And what they came away with, and which I think is most telling, is their conclusion was, and I quote, "The semantics of professionalism obfuscate more than they clarify." Similarly, there was an article done by the governing bodies that evaluate medical boards after graduation, and they looked at 20 different articles and definitions based on their member boards. Again, unable to come up with a unifying definition. What I think is most important and most really convincing or convicting about what is professionalism in medicine came from the letters to the editor of the articles in which I looked at, the two review articles. In fact, the same two authors responded to both of those review articles together. One was a physician from England, and the co-author is a dentist from the Netherlands. And what they said was, basically, that we needed a dose of common sense. First, they quoted Boerhaave, of the famous Boerhaave esophagus. He practiced in the 1600s and early 1700s, and they gave him the title of the founder of clinical teaching, whose motto in Latin was Simplex Sigillum Veri, or simplicity is the sign of truth. They suggest that the definition of professionalism in medicine should be simple, and they recommended placing the best interests of the patients at the center of everything you do. They also quote an abdominal surgeon who practiced in the late 1800s and early 1900s, Dr. Murphy, whom they've given credit for giving the first lesson of medical school. And they quote him as saying, "The patient is at the center of the medical universe, around which all our works revolve, and towards which all our efforts tend." And that is clearly easier said than done. I mean, I have a wife and kids, and I also like to coach Little League, and so my activities go beyond the hospital. But they come back in their letter, and they point out a few things that are truths. That number one, the whole reason we went to medical school was because of patients. The whole reason we get up in the morning and go to work to read films or to do IR procedures is because of patients. And ultimately what they say is that the patient is truly our only right to exist, because without patients we wouldn't have jobs. So while it is difficult to pin it down, common sense does rule that we should put patients center. What's, I think, easier to identify rather than to professionalism is what is unprofessional. I think that's much more agreed upon to a point. In fact, what I think you could define as professionalism in medicine may be the normal functions of a physician with their patients and society that is not unprofessional. You know it when you see it, when you hear it, or when you feel it. So what about professionalism and unprofessionalism in medical residency? There is very little information about residents in the literature. Most of it focuses on medical students. But the reason it focuses on medical students is the original article that came out in 1994 by Hafferty and Franks called The Hidden Curriculum, or talked about the hidden curriculum. And what is that? That is the culture, the unprofessional culture, or the culture of unprofessionalism, that is perpetuated, either intended or unintended, by faculty, staff, and senior residents in teaching hospitals. And so some of the components that are looked at in unprofessional behavior are things such as having observed falsification of medical records, or having felt humiliated by a faculty member, or by a nurse, or by a patient, or by another resident, having observed criticism of another service by your faculty or another resident, and having observed a resident being disrespected in such a manner. Now, of those studies, on medical students primarily, the things that they've identified that have brought concern, that have led to the ACGME prompting us to evaluate residents on professionalism and medical students on professionalism, the reason it's in the forefront are that during medical school, nearly all medical students reported observing unethical and unprofessional behavior. Not only that, they went on to admit that they participated in what they considered unethical behavior. And they, by the end of medical school, from the beginning to the end, demonstrated less empathy, more cynicism, and a decline in humanitarianism. So the literature concludes for students, and to some degree for residents, that this may lead to a contradiction of professional standards, undermining professional ideals, dehumanizing patients, and perpetuating an unprofessional culture. So I leave you with that, which is, where do you lie as far as what is professionalism in your own minds? And is the hidden curriculum affecting you and those you teach? And is it affecting you by those who teach you? Thank you.